This is Dr. Paul Thomlinson from Compass Health Network, and this is our podcast aimed at inspiring hope and promoting wellness. Here we try to offer listeners a better understanding of some of the challenges of these times we're living in and living through. An understanding built on insights from research in the social, behavioral, and health sciences, as well as from stories of lived experience. The bottom line is we need to find and apply the best evidence we can so that we can know, do, and be better and better. This episode flows from our observance of National Disability Employment Awareness Month, usually just called Disabilities Awareness Month, where we shine a light on and celebrate the contributions made by Americans with disabilities and recommit to promoting equal opportunity and respect for all people. Now, for a very long time in this country, employers could refuse to hire you if you had a disability. Stores could turn you away. If you used a wheelchair, there was no real way to take a bus to work or school or find a public bathroom that would work for you. America just wasn't built for all Americans. Now, thankfully, we've made a lot of progress, but there's still a long way to go. And we know that people of good intent often just don't know how to think, do, and be better about being a support and ally for those with disabilities. That's why I wanted to talk to my guest for this episode, Lacey Wilson. She knows a thing or two about how to make her way in the world with limitations she's had since birth. But I'll let her tell you all about that in a minute. Lacey has been a licensed professional counselor in Missouri since 2014, and she's currently working toward her PsyD, her doctorate in psychology, at Kansas City University, with hopes of implementing more psychological assessment opportunities in the private practice she's built. Now, she's trained in EMDR, a trauma therapy, and has experience working with individuals, families, and couples. I want to preview a few of the highlights of our conversation, like, first, the fact that she didn't walk until she was 6 years old, at which point she decided she was ready and said, "Hey, Mom, I think I'm ready to walk to you." She decided and she did, illustrating the powerful intersection of readiness and decision. Another thing for us to take to heart from this conversation is how, as she puts it, she stood on the shoulders of giants, her parents in this case, to get to where she is now, highlighting the importance of allies and natural supports. Still, another highlight is hearing how finally, for the first time, she's being supervised by a psychologist with a disability, and seeing how her own aspirations and dreams being lived out in front of her by a person with a disability is so important. And there are lots of other hope-inspiring pieces in our conversation, I think, but I happened to run into Lacey's dad, Doug, over the weekend, and it's hard to miss how proud he is of his daughter. He beams when he talks about her, and how smart and talented she is. He told me about how, from very early in her life, he tried to impress on her that she has such a bright, beautiful mind, and because of her physical limitations, she would need to develop that and make a living using primarily her mind rather than her body. And she obviously took Dad's advice. I hope you enjoy hearing from Lacey as much as I enjoyed talking to her. I'm here with Lacey Wilson. How are you?
I'm doing good. How are you doing?
I am just dandy. And thank you so much for your time given so generously for this podcast episode, really tied to our observance of National Disability Employment Awareness Month, which is a real mouthful. The focus is on the milestones of our treatment of folks with physical and other disabilities in the workplace. That, we've made a lot of progress, but still have a long way to go. So we need to continue, as you know better than anyone, we have a long way to go. So, but we continue to shine the spotlight on it with the intention of, at least from our perspective at Compass, to inspire hope and promote wellness. Would you mind just starting off and sort of sharing the Reader's Digest version of the nature of your disabilities as you define it, as it's been defined for you, or however you want to talk about it?
Sure. I was born 3 months early in the late 80s, and due to the lack of oxygen to my brain at some point during my mom's 48-hour labor, bless her heart, I did not get enough oxygen, and it caused me to have cerebral palsy. I I also had a twin sister who was unfortunately stillborn. We were just way too premature, born at 26 and a half weeks. And then growing up, I was able to care for myself to some degree. I didn't walk until I was 6 years old, actually. I had a little walker that I would scooter around with, but there was a point the doctors had told my mom, if she doesn't walk by the time she's 6, she probably never will. And I can actually remember this. I can't really explain it, but one night, I was about 6 years and 3 months, I would guess. And all of a sudden I just said, "Hey mom, I think I can walk to you." And I did. And ever since, I've been getting around. When I was 8, I had a very intense but very successful neurosurgery called a selective dorsal rhizotomy. One of the best doctors in the world that does it, Dr. Park at the St. Louis Children's Hospital. They go into your spinal column and clip some of the nerve roots, and it releases the muscle spasticity or the muscle tightness. And that really changed my life to where I got to where I am today in terms of still walking independently at 34 years old. I drove at 16, just like every other kid out there. There wasn't any stopping me in that regard, I think. I don't drive with hand controls, so for now I'm still able to do that. And I live independently with me and my 3 dogs. I don't know why I have 3 dogs, but I do. And then me and my 3 dogs, and just going to school, and that's kind of how I got to where I am today. Not that it hasn't been a lifetime's worth of physical therapy, but also and a lot of hard work. But I don't see those things as necessarily, like those surgeries and things, as necessarily traumatic, because they helped me so much. It really is like a before and after point in my life in that regard.
Yeah. Well, you spoke about your driving, and of course, one of my favorite things that you own is that beautiful blue Toyota that you tool around in. So
it's the color of a Smurf, but
Smurf
yeah,
mobile, but
I like it too.
It's beautiful, and you drive it safely and well, better than many drivers I'm aware of. So so
I do my best. So
thinking about our purpose here, which is to really shine a light on inclusion, exclusion, those feelings of being excluded from opportunities. Can you just maybe talk about your experiences of feeling excluded, especially due to your disability, and what that's like for you? And importantly, most importantly, perhaps, typically, how do you respond when you feel that way, when you feel excluded because of that?
Yeah, I mean, I feel really fortunate because I went to the same school from kindergarten through 12th grade, and it was a fairly small school. And so everybody knew me, and I think and I hope I was pretty likable. So in terms of being included, I mean, my mom is a powerhouse within herself, because she actually I didn't find this out until I was probably in my mid-20s, but she actually nearly had to sue the school board at one point, which I think is okay for me to say now. It was 30 years ago, because they weren't providing me the physical therapy services I needed, and I actually regressed in early childhood. And so, but they got that lined out. And from then on out, the school board was always like, just tell us what she needs, Mrs. Wilson, and we'll get it taken care of. And so to have the bravery to do that, I think is pretty cool. Hopefully I stand on the shoulders of giants a little bit in that regard.
Oh, absolutely.
But going back to feeling excluded, though, I did have one instance in, well, not just one instance, it was unfortunately the entire school year, where I got bullied pretty badly by one girl. And that's honestly probably one of the most traumatic things I've been through. some of the stuff she would do now in hindsight is kind of dumb because we were fifth graders, but
Yeah.
that's also a really bad age to be bullied. And so in terms of feeling excluded in that regard, that was really the only big instance I can think of. I had a lot of people looking out for me that probably if you would have said anything about me, you'd have 5 other people jumping on you. And so
Yeah, exactly.
in terms of exclusion, as I've gotten older, I've had to learn where my mom used to fill that place of advocating. I've had to learn to do some of that for myself. Yeah.
Well, you have an amazing attitude about it. And you also brought up standing on the shoulders of giants. And also I think about, your mom, and of course I know your dad, and how amazing they have been as allies for you, as supports. Really that's what this is all about, is learning how to stand shoulder to shoulder, learning how to walk next to someone and advocate with and for them, etc. So what can you tell folks about what you do and don't want, and what is and isn't helpful as regards being a good ally or interacting with you in a way that is inclusive and helpful?
Yeah, I was really fortunate this last school year, honestly, because for the first time where I was doing my practicum at, I was at the UMKC Counseling Center for Students, and the director of that program is actually Dr. Arnold Abels, and he's blind actually. And so we didn't talk about our lived experiences a whole lot, but even in school and things, I've always been like the only one with a physical noticeable disability, it seems. And so I also realized that there are many types of disabilities or severity of disabilities where it would just not be feasible to get the level of education that I have been able to obtain. And so I do recognize that I'm fortunate in that regard. But in terms of just being kind of the only one in a group, even though, yes, we do take focus on diversity, up until this last practicum, I had never really met another disabled psychologist, especially in that regard. In terms of how I approach it with my clients is, it's funny because I know they won't be able to see me, but I'm very small. And so one thing that struck me as funny is adults could never tell how old I was, but once I started working with kids, they could never tell how old I was either. And I didn't anticipate that at all. They'd be like, "Are you a kid or an adult?" And I'm like, "I'm a very small adult." Okay. But maybe this is more about me. I don't know. Maybe this is something I need to work on. But like, I always try to find a way to bring it up with clients within the first session or two, just because I kind of feel like it's the elephant in the room. And maybe that's more about me than them, like I said. But nobody has ever really thought anything of it. And I've also thought, like, I've never really gotten the chance to, but I would really like to, I think, work with people who have become disabled, because I really think it'd be harder to become disabled than be born disabled, because you recognize what you've lost, with the flip side of that being, I never got to experience anything different. So I guess there's pros and cons too.
Sure. Yeah. Well, while we're on this subject, and I know you to be a person who's very forthright and you'll speak your mind, no matter in a kind and gentle way usually. But do you have pet peeves? Some things that have come up over and over. It's like, I really wish you wouldn't do that. What can we learn from the mistakes of others as regards pet peeves?
Probably my biggest one, and the one that just immediately comes to mind, is that able-bodied individuals, people tend to forget the person behind the disability. I was actually kind of talking about this with some of my fellow practicum students at the practicum I'm at right now, because one of them was getting ready to do a WACE or an IQ assessment on someone with autism. And so it wasn't a contentious conversation or anything. I just said, they were looking for some supervision about it. And in group supervision, I just reminded everyone, don't forget the person, because I've had experiences, and it seems to happen most when I'm with my mom or sometimes with my friends, but it's like people will talk to them instead of talking to me. And I think they'd be stunned at the amount of education I have, like
Right.
I'm perfectly capable of ordering my own food. Thank you very much. And I'm not a jerk about it. I will say it's given me a bit of a complex, and it does hurt my feelings, but I'm never one to just be like, how dare you, or
Yeah.
anything like that. It's more about, whatever they ask my mom or whatever, I just speak up and answer the question. And hopefully within the first 30 seconds or so, they can see that I do have my facilities about me and everything. And so I think sometimes just because my body moves differently, that doesn't immediately mean I'm intellectually disabled or
Yeah, of course.
anything like that. And I won't say that just experiencing these things throughout an entire lifetime so far haven't made an impact on me, because I do really struggle with my self-confidence in certain ways and things like that. But we talk about in therapy like those big T and little t traumas. The big T's are like the major things that happen. The little T's are the little things that are said to you, over the microaggressions said over and over again. But the problem, as we both know, is they can kind of snowball into like the big T or capital T trauma. And so in terms of pet peeves, that's really the only one that comes to mind, is just that, again, just because my body moves differently, it doesn't mean that I am not intellectually capable.
Right,
Or
for
things
sure.
like,
What I heard you say in a way was, my interpretation would be, you don't like it when people underestimate you. I mean, you get inconsistently underestimated on the basis of one characteristic that really has nothing to do with the person, that's standing or sitting there.
I don't know, maybe that's why I'm such an overachiever. What do you think?
Could be. So you mentioned trauma. So I've got a couple more questions when we wrap this up here. But
Yeah.
you mentioned trauma, and of course, I've been talking to you. If you're comfortable talking about it, if not, that's fine too. About your developing a podcast around some of your passions, both academic and personal, professional passions. Do you want to talk about that at all?
Yeah, I'm starting a podcast about how I really feel like we are living through mass trauma as a country and as the world, in terms of what we've been through with COVID in the last few years, the gun violence we experienced, the racial trauma, the healthcare disparity. And so I'm starting a podcast called The United States of Traumerica, like trauma. It's TRAUMERICA. And
Trauma.
it's going to focus on all of those things collaboratively. I'm going to take several episodes to go over what trauma is, who gets trauma, and then we're going to go into more of the mass trauma side of things, and how, even I think, going back to that snowball method of how individual trauma can spur into mass trauma. And I've also done a lot of study, and not YouTube study, but real studying on authoritarian governments the last 4 or 5 years. And so it's also going to have a focus on how mass trauma can shape those things. I mean, that's one of the prime factors I've come to learn. While it doesn't happen in a vacuum, that's one of the prime factors I've come to learn that can push people towards following an authoritarian leader. And so that's probably veering towards what my dissertation is going to be about in some regard. And it's become my passion, and I'm I'm very excited for the podcast. I'm hoping to return the favor and maybe interview you at some point. And then, so yeah, look for that to be out within the next couple weeks. And if you could like and subscribe when you hear about it, that would be greatly appreciated.
Thanks. Well, I'm fascinated by it since you first brought the idea up, and so I'm looking forward to what you're going to bring to the world. You have such a wonderful and unique perspective. So let me close with this. What do you have for us by way of inspiring hope, promoting wellness, to close our conversation?
Well, I have a couple things I can think of. The older I get, I really am starting to understand the concept of you really are your own best advocate. Because I mean, my parents are not going to be around forever. And so again, standing on the shoulders of giants, but I think just advocating for yourself, you know what you need best. And so far, I think, as long as you don't approach it aggressively, I've been able to get whatever needs met that I've had in the past. And if there are any parents with children with disabilities listening to this, I told my parents one time in my mid-20s or so, I told my mom one time, I said it in kind of a crass way, but I said, thank you for actually giving a crap about me. And maybe it's not even so much about like giving a crap, because there are a lot of parents out there who do love their kids very much. They don't know where to turn. But I don't think I would have made it nearly as far if my parents hadn't been able to give me the twice weekly physical therapy I needed for the first 15 years of my life. I don't know if you knew this, but my dad was actually a stay-at-home dad for a couple years when I was in early childhood, because my mom had the better health insurance and I just needed so much care. And so, I've always been a bit of a daddy's girl. And even if financially parents are maybe not in that same position, just getting your kids the best that you can is going to take them so far. The one thing I do wish my parents maybe would have picked up on a little bit earlier is in terms of resiliency. I've done a lot of therapy for myself as well. I've been in therapy for several years now at this point, and I do wish they had picked up on maybe some of the emotional struggles more, because I was always an incredibly anxious child, and my mom would tell me, well, but your grades were okay and it's not like you were losing sleep. And I got to thinking about it, and actually I was losing sleep. I'd lay in bed at night worrying about stuff, but how do you verbalize that when you're 8 years old? And I know premature infants are more prone to like PTSD or depression or anxiety. And I have a bit of a theory. It's because if we are struggling to breathe the second we burst onto the scene here, like that could set our little lizard brains up to be like, oh my God, I'm dying. The world's a scary place. So I would encourage, if there are any parents, just to get your kids proactively into therapy even. And if they don't have anything going on, then great. Maybe try again in 5 years if they need it. But that would be the biggest thing is that. And so was there any other part of that question that I
No, you nailed it as always, but I'm struck by that theory. Seems like that might be a good dissertation for you to follow up on.
That was one of my like shortlisted ones. So.
But that was such a stark image you have, when you burst onto the scene, when you come into the world and you're first, all of us are struggling to breathe at first, but when it's even harder, when that is the first thing, just fighting for life, and it doesn't seem to get much easier for a while, it has to have a framing experience to it.
When you're in the NICU, while all babies are helpless, like I never knew, okay, is it going to be my mom that's, gently caressing me, or am I going to get poked with something or have a tube shoved somewhere in my body, or, and so it's just a theory, but it actually makes
You know,
sense.
you think about
So,
Eric Erickson's, the first stage, right? Trust versus mistrust. I mean,
yeah,
hard to
yeah,
develop trust when you're getting poked and prodded all the time.
right.
Well,
So,
we're about out of time, but as always, you are a bright light in the world, and I always talk about people who inspire hope in me, and you're definitely one of those people. You always have an amazing attitude, and your thinking is so spot on and inspiring, and I just can't thank you enough for spending some time with me, and I'm happy and excited to share some of your story with the world.
well, thank you for having me, and please check out my podcast in the coming weeks.
The United States of Trumerica.
Yes.
That's right. I love that title. It's going to be so good. I'll talk to you soon.
Okay, thanks.